Rounds. It's my pleasure to introduce today's speaker, Dr. Mark Norris, who for the vast majority of you needs no introduction whatsoever. Mark is a long-standing member of our faculty, having been on the faculty for 15 years. He is an associate professor in the Department of Pediatrics in the Division of Adolescent Health. And in fact, will shortly assume the leadership of the Division of Adolescent Health as its division chief. He has clearly had a long-standing interest in adolescent health and has led many initiatives in general aspects of adolescent health, and also with a specific focus on eating disorders, in which he's published very broadly. He is past president of the Eating Disorders Association of Canada and has been awarded fellow status by the Academy of Eating Disorders for distinguished work in the field. He has also served as co-author on the Canadian Pediatric Society position statements that examine screen time considerations for children and adolescents. And so today that is going to be an aspect of his focus, promoting healthy screen use in children and adolescents within the context of COVID-19. So please welcome Mark.
Thank you, Karen. Good morning, everybody. These are my disclosures. Over the next 45 minutes, I'm hoping to take you through a talk, which for those of you that are just signing on, was originally a little bit longer in duration, and I've taken out quite a few slides, and so I'm hoping that we can still hit all of the salient points and leave some time for questions. So these are the objectives. We'll review health benefits and risks of technology in the lives of children and youth using a developmental lens. We'll look at some of the key recommendations drawn from the Canadian Pediatric Society's position statement regarding healthy screen use in school-age children and youth. And then at the very end, we'll talk a little bit about COVID-19 pandemic considerations in the context of how to counsel patients and families on healthy screen and technology use and some of the challenges that brings. It's interesting, in my bio, it certainly speaks to the research and the work that I've done in eating disorders, but this was an area that I was originally quite interested in when I joined the faculty. It speaks to the role of mentorship and kind of resources that were available. There weren't really a lot of people doing research in this area 15, 17 years ago, kind of around these parts. And it was more related to mentorship in terms of how I ended up going down the road of eating disorders as opposed to staying on task with these themes. But this was certainly something that I was quite interested in way back when. All right. So what brings us together today? Digital media is integrated everywhere into the lives of children and youth. That should come as no surprise to anybody. One of the big questions that we get asked quite a bit in our clinic, and I'm sure for all of the general pediatricians that are online here, are around questions of how we best support children and youth as they use digital media. We're often asked the question, what's okay? When should I be worried? How much is too much? And these are, easy questions to ask, but not necessarily always easy questions to answer, especially if you're looking to the published literature to try and help guide you. Really important that, as we make our way through any discussion that involves screen use, that we're all talking the same language. And so over the course of the next 45 minutes, you'll probably hear me use a few different terms to describe screen use. And in the published literature, it's also referenced in a number of different ways. The purpose of this talk, we'll be using the term screen media activity, but I just want everybody to know that that will encompass basically anything that relates to screen use, including television viewing. Really important, though, when you're reading studies or trying to examine studies, that you kind of read the fine print, as they say, because how these terms are defined can impact the findings and outcomes that are drawn. Just by way of background, Kieran mentioned that I was a co-author on a couple of papers, position statements published by the CPS. So this is work that has been ongoing for maybe over the course of 3 or 4 years, the last statement being published in June of last year. That study, or really a summary statement, focused more on school-age children and adolescents, whereas the first paper really focused on the young child, 0 to 5 years. It's a large task force. I've listed everybody's names at the bottom. Alison Shaw, also obviously a CHEO faculty member, was also a key member of that committee. When we talk about digital media, we can, a lot of the literature, a lot of the published literature is US based, although there certainly is an emerging Canadian base. Media Smarts is an organization based in Canada that has sought to try and increase the amount of information that is out there as it relates to kind of what we know about digital media in children and youth. These are some recent facts that were taken out of their most recently published study back in late 2018. Maybe not shockingly, about 75% of families report having a mobile device in their home. Interestingly enough, across all age categories, so this is actually 0 to 15 years, the most frequently reported device that children have their own access to is a smartphone. I was a little bit surprised by that, considering that we're really talking that study included younger children as well. Children's overall levels of access to their own digital devices is increasing with age. That probably comes as no surprise. And over 1/3 of all children are using digital technology for schoolwork. That was back in 2018. Those numbers are clearly going to be higher in 2020, maybe upwards of 70 to 80, possibly higher in the context of the pandemic. The number one digital activity for families, again in 2018, was found to be watching TV, followed by YouTube, which my sense would be that if this was repeated right now, that those proportions would be different. One of the challenges in immersing yourself in this literature is the fact that the landscape changes so very quickly. Something that, if it's an interest area of yours and something that you're interested in or wanting to try and keep up to date, every month there's some every month there's some some good studies that are coming out that are helping to better help us understand what's happening. The same group, Media Smarts, in their study noted that about 1/3 of 10 to 13-year-olds spend 3 hours or more per day using media. Again, it would likely come as no surprise that this number is almost certainly higher in 2020. More than 50% of Canadian parents surveyed report that the less time their child spends with digital technology, the better off they are. Interestingly enough, 2/3 of parents agree that their child benefits from the digital technology that they use. So this is a really important point that you'll see me attempt to discuss over the course of this presentation in terms of the risk and the benefit associated with screen use and screen media activity. These are our actual objectives for the talk. So the first is we'll review health benefits and risks of technology in the lives of children and youth using a developmental lens. I'm actually going to spend the majority of my time talking about objective number one, and then we'll try and use that information to look at the summary recommendations that came from the Canadian Pediatrics Society statements. And then finally, I'll probably spend 5 to 7 minutes looking more specifically at COVID-19. We can take everything that we learned from objectives 1 and 2, and then it should be relatively straightforward in terms of how we proceed with objective 3. Screen time remains a defining factor in the research of healthy media use. This is, a relatively straightforward statement, but you can imagine if you're attempting to really rigorously study screen time and screen time in studies, there are an awful lot of factors that need to be taken into consideration. And maybe not shockingly, an overwhelming number of confounders that can oftentimes influence the results that you seek. We want to keep in mind that we're trying to address key issues and considerations in children and adolescents, but there's a really big difference between what would be recommended and appropriate for a 6-year-old as opposed to a 16-year-old. And we can narrow that gap, quite a bit more. And I would argue that there's probably quite a big difference between what would be recommended and appropriate for a 12 or 13-year-old and a 16-year-old. There's a greater breadth of research available in the early years. So when you really go and try and understand more completely what's out there, what's been published, what we feel confident about in terms of the results that have been garnered. Pretty good amount for the 0 to 5 year group. I would say an emerging and better amount of information for the adolescent years. Not a lot, interestingly enough, for that 6 to 11 year age group. I think it's really, really, really important. I could probably put a few more reallys in there when we talk about screen media activity to take that back to the developing brain. And certainly, despite advances in our understanding of brain growth and development over the last 2 decades, there's quite a bit still to learn. Increasingly, more and more studies seek to understand the impact of digital media on a developing brain. And that's really looking at multiple markers, including intelligence, internalizing behaviors, externalizing behaviors, psychosocial outcomes, etc. For those of you that need a very, very quick brush up on the developing brain, and I am, not a neuroscientist. Brain development is something that I have an interest in, but it's certainly not something that I would say that I'm an expert in. There's a lot of stuff happening in the brain across, the entire span of your childhood and your adolescence, and that begins in utero when experiences are clearly important for shaping later development and growth. Clearly, a massive period of growth and development in the first 5 years of life. And the remainder of that first decade is really important in terms of preparing a foundation for the second phase of tremendous development, which occurs in adolescence. In adolescence, the brain, as with most other organs, undergoes tremendous growth and maturation, characterized by a couple of really key events. Synaptogenesis and synaptic pruning take place during this time frame, and that can be summarized by an expansion of the white matter with subsequent reduction in gray matter. So you'll recall that gray matter is where most of your cell bodies kind of are located, white matter, myelinated sheaths, and information highways. And there's a lot of functional networks that are developing and expanding. There's a lot happening. Neuronal plasticity is another key element. So there's a lot of neuronal changes that are occurring as a result of acquisition of new skills and life experiences, which are important for learning and also adapting. And so you can imagine if you have the degree to which you can acquire new skills and experience life and experience, different aspects of life will undoubtedly affect how your brain develops. Important, of course, to keep in mind that there are many varying factors, including gene expression and life experience, that help shape this, and that nothing is occurring in isolation. And as it relates to findings in these studies, I think that's probably one of the biggest and most helpful points to keep in mind, is that nothing is occurring in isolation. And so the results that we arrive with at the end of a study need to really be kind of taken into context in terms of not just kind of the on-the-ground details, but some of the larger considerations. Why is this relevant? Well, for those of you that have interest and experience in working with adolescents, you'll know that certainly chronological age of a child is important in terms of how you attempt to counsel, provide guidance and support. But we also want to keep in mind kind of where that child is at with respect to their developmental progress. Just because a child is 13 chronologically doesn't necessarily mean that their brain is quite there. They may be precocious and a little bit further along. They may be delayed and a little bit behind. But it's really important to keep that in mind, because what works for one might not work for all. We can't, if only it was that easy that we could, apply simple algorithms and a one-size-fits-all cookie-cutter approach, but that is certainly not the case in this area. So we need to keep that in mind as it relates to counseling. Younger adolescents that think very concretely are probably going to do better with messages that are concrete. Their ability to kind of think abstractly, to really conceptualize and think into the future is going to be far more limited than somebody that is 17, 18 years old. It's not always black and white. In our world, there's often a large degree of gray. There are many other considerations, and it's not just the physical environment that's important and or changing. There's certainly hormones, neurochemical frameworks. There's a multitude, a conglomerate, if you will, of different factors that are at play, each of which are influencing and playing off each other. One of the biggest challenges that I often have when I'm reviewing these studies are the lack of consideration of other, what I would say are critical considerations. And these three areas are areas that I'm extremely interested in and have tried to incorporate into study. And certainly we've been trying to look, I've been working with Claire Gray around trying to incorporate these specific areas into more mental health research. But the role of nutrition, sleep is a really, really important factor, especially as it relates to screen media use and physical activity. If you were to go and look at the literature in an attempt to try and understand kind of what studies have shown and demonstrated, I would say that prior to 19, the majority of published studies were limited by quite small samples. Quite a few studies, but most of them, the cohorts that are involved are quite small. Definitions of screen media activity varied, which obviously will impact kind of the results that researchers seek to find. And as I've noted, many studies are unable to or inadequately account for numerous confounders. So very difficult to draw any firm conclusions. I'm not sure if anybody online has heard of the ABCD study. But this is, in my mind, this is a study that seeks to really change the landscape, maybe define the landscape, if you will. This is the largest long-term study of brain development and child health in the United States, funded by the NIMH, say that 5 times quickly, over 21 sites scattered across the entire U.S. and almost 12,000 youth invited. So they get invited between the ages of 9 and 10, and they're asked to kind of sign on for about a decade. It's a very intensive, rigorous study that looks at the collection of blood. It looks at psychological measures. It looks at parental report. It looks at anthropometric measures. It looks at brain imaging, MRI studies. Very, very complete. And researchers are seeking to track biological and behavioral development through adolescence into young adulthood. So screen media activity is one aspect of this study, but there are numerous aspects that really, are looking at factors that are all encompassing as it relates to adolescence. This is a quick overview of what that study entails. So you can see at the time of intake, you're looking at 6 to 7 hours of intake assessment measures and 3 hours of parental activity measures, which for those of you that don't do research, I would say it's a big investment and a big ask from families and from youth. Despite this, they have had excellent success in enrolling patients and they're more than well on their way to reaching their target. And as a result of, I think the actual study, they're 2 years in, and there's already well over 100 papers that have been published that have drawn from data that have been taken just from the assessment phase of the study. This was a summary statement that was included in one of the position statements that came out of the CPS that I think it's really important as we seek to understand how the digital world has the potential to influence the adolescents. Whenever I work with an adolescent, I'm always trying to understand where they're at with respect to, some very basic issues. And I would say that the digital world can influence all of those issues. And those include milestones, general adolescent milestones, social connectedness with peers, where they're at in terms of a sense of identity, identity formation, that very delicate balance in terms of moving from a completely dependent individual to an independent, navigating the social cultural world, and of course, developing autonomy. I mentioned this at the very beginning, but this is one of the key factors, I think, that we're always seeking to better understand as it relates to screen use and screen media activity, and that's the risk-benefit relationship. As I noted, in any given month, more and more studies are published. This was probably the most recent systematic review that I was able to find, and this was published in mid-2019. This was taken from the UK. The group pediatricians in the UK that stated that based upon a systematic review of available evidence at that time, they concluded that the absolute evidence base for an absolute screen time limit is currently weak. And we can talk a little bit more about that as we move forward. We try and understand what are some of the potential mental health and developmental benefits of SMA are in early school-aged children. So if we go back and look at the literature that's been published, there's a few themes that kind of run deep. Online and cable programs that are co-viewed and watched with purpose can be immersive and informative. And you'll notice that there's a lot of words in that statement that are very important, one of which being co-viewed, the second of which being, purposeful activity. SMA can improve knowledge, enrich literacy, and enhance academic performance. And early research suggests that digital literacy can help children make and maintain diverse relationships. If we look at the potential mental health benefits and developmental benefits of SMA in adolescents, moderate amounts of SMA has been associated with some positive psychosocial effects in youth across multiple studies. The type and timing of SMA is clearly important, but the results aren't linear. And that speaks to one of the statements that I made earlier in terms of nothing is occurring in isolation here. I would argue that it's probably more challenging to understand how moderate amounts of SMA impact adolescent development as opposed to extremes in use, for example. And that's something that if there's time at the end of the discussion, maybe we can circle back and address in more detail. In terms of potential health risks in early school-aged children, maybe not surprisingly, exposure to age-inappropriate and violent content can have negative consequences on brain development and behavior. Solitary screen use increases risk of exposure to harmful stimuli. This is something that when I first read about findings in media multitasking, I was actually quite surprised. I think, 15 years ago when, I had my own hypotheses and areas of interest, I was of the assumption that, the ability of children and youth to multitask and do, all of these different things at once would only kind of make them better at completing tasks and enrich their life, if you will, as they got older. The studies are pretty consistently showing that that's not the case. Media multitasking has been shown time and time again to negatively affect learning and uptake. And so I think for me personally, as a clinician that clearly has an interest in this area, it's been a really important point that I use when I'm helping to counsel youth and their parents. Early research suggests risks for both internalizing and externalizing psychopathology in heavy users. We'll talk a little bit about that over the next couple of minutes. And an emerging body of research suggests associations between depressive symptoms and sedentary SMA in younger children. So depressive symptoms being, internalizing. Internalizing examples of internalizing behavior, anxiety, depression, probably the most commonly cited issues. Externalizing would be impulsivity, oppositionality, acting out, if you will. If we look at adolescents, there's certainly some overlap. Excessive screen use has been linked to depressive symptoms, anxiety, and sleep disturbance. Media multitasking has been associated with lower scores in working memory, attention, and higher impulsivity. And there are certainly suggestions that the degree of parental monitoring decreases after grade 7, thereby increasing risk of negative exposure and overuse. I contemplated inviting my daughter to this talk and doing kind of a little bit of a panel, because I'm sure if she was online, she would tell you that it's extremely difficult to have me as her dad sometimes, as it relates to her phone and the limits that we are constantly attempting to place on her screen media activity. This is something that I think for any of the parents that are out there is a challenge, and it's not something that is easily attended to, or that you address it on 1 or 2 occasions and it gets better and doesn't present itself again. This is something that for, I think, a lot of us, we spend a lot of time, we should be spending a lot of time trying to assert our ability to ensure that our kids can stay on track, because the amount of information that is present online and present through a multitude of different apps puts a lot of children at risk. Not every child, but a lot of children at risk in various ways. If we want to try and break this down further and look at more specific considerations, we can look at studies that have examined brain structure, brain function, other health-specific physical risks, and then we can look at cognition and psychosocial and mental health outcomes. As I mentioned, prior to 2019, few studies, did this well, to say it simply. Of the studies that had been completed, there were some associations that were seemingly ringing true and being shown across multiple studies and with different samples. Among those, in 2015, an early study of 18-year-old college students showed that video game addiction was associated with lower gray matter volumes versus the control. This was also shown in 2016 with female habitual internet users versus controls. If we go back to that ABCD study, so this is the largest study that I've come across, and probably one of the most comprehensive studies that has sought to better understand the question of brain structure, if you will, and SMA. So this was a study that was just published, I think, early last year, just over 4,000 adolescents. So these would be 9 and 10-year-olds. And they looked at cortical thickness, sulcal depth, and gray matter volume. And they found that, each of these correlated strongly with SMA in terms of a negative correlation. That's certainly something that, over the course, I think one of the things about the ABCD study is that, it's already presented and given us a lot of information that's quite important. But the best is yet to come in terms of what this study seeks to better clarify over the next 10 years. Now, it's not all concerning. Certainly, there are individuals that have high rates of SMA, and this has been shown in the ABCD study as well, that have greater maturation of their visual systems. The SMA has also been shown to be important for sensory processing and higher order cortical functions. Again, these relationships are very complex and not unidimensional. Really difficult at this point, especially at this point in this trial, to say definitively that SMA-related variables result in negative outcomes. Certainly a few things that people are going to be watching very carefully with this cohort as we move forward, but we're not at a place yet where we're able to, or we want to necessarily come out and make strong recommendations based upon the findings that we currently have. As it relates to brain function, there is some early evidence from functional neuroimaging studies that suggest those with problematic internet use fail to recruit frontal basal pathways. And those are pathways that are important in inhibitory control. when I first read this study, the obvious question was, is this a chicken or the egg phenomenon in terms of, are these children that are already wired in such a way in which they're at risk and potentially vulnerable, or is it the actual habitual and problematic internet use that is helping to shape brain development? Again, the jury's out. We don't know, but we can certainly speculate that that both of these considerations are important. There's a lot of conflicting evidence as it relates to psychosocial outcomes. As I've mentioned on numerous occasions, there's a number of important confounders that haven't always been considered. Smaller studies have linked high rates of SMA and psychopathology. This is actually a CHIO-based study. I'm not sure if Gary Goldfield is on the call or not, but Gary looked at rates of depression in the REAL study that was completed here a number of years ago. Anxiety has been shown, externalizing behaviors, and high-risk activity. Again, if we try and understand, how this makes sense, I think part of what we need to really fully understand is the timing of all of these different events and how SMA affects and should be considered as it relates to when a child steps into that world, if you will. And I would say, as it relates to counseling, it's one of the really important points, at least when I'm counseling parents and youth, in the realm of trying to delay the introduction of phones and smartphones. So some but not all SMA-related factors corresponded with higher externalizing psychopathology in the ABCD study, but not internalizing psychopathology. Now, I guess the question is this something that is surprising? From my mind, no. I don't necessarily see that as surprising. If you think back to the earlier slide with the chicken and the egg, we're probably more likely to see issues relating to externalizing behavior upfront and early on, whereas issues related to depression, anxiety are likely going to play out a little bit later in the game. So this would be something that I'd be interested in really circling back to kind of have a look at what these studies are showing 2, 3, 4, 6 years down the road. The dangers of all or nothing. Research suggests that zero as well as excessive SMA places adolescents at greatest risk. So this is, when you're screening and when you're asking questions, I think it's important to try and kind of come away from an assessment with a general sense of where the child is at as it relates to kind of total SMA use. Balance is important. I have a slide that kind of comes up. But certainly when we have youth that are engaging in all or nothing behavior, we want to try and understand why that's happening. There are likely factors that are influencing that behavior, and it may be that those factors and those influences are also increasing that individual's vulnerability in different ways. Just kind of spoken to that already. As it relates to cognition and intelligence, so there's two ways of looking at this. Fluid intelligence, which is the ability to solve new problems, use logic in new situations, and identify patterns. And crystallized intelligence, which is the ability of individuals to use learned knowledge and experience, which it doesn't necessarily equate to memory, but it does rely on memory. So researchers have sought to try and understand how markers of fluid and crystallized intelligence are impacted by SMA. And maybe you can guess what some of the findings have shown. There's been a lot of variation over the course of early studies. In the ABCD study, there was a positive relationship between fluid intelligence and gaming activities. And if you can try and kind of take a step back and think about, how a video game and playing a video game and trying to be strategic and plan ahead how that might relate to brain development. You can certainly, I think, speculate and hypothesize that there could be some positive associations there. A strong negative relationship between fluid intelligence, however, and social media use. One of the challenges I have with the term social media use is that it's kind of all-encompassing, and social media use, can really mean a whole host of different things, many of which are completely mindless, but some of which increasingly so may recruit, different pathways in terms of, our level of engagement. Social media has been shown to have a strong negative effect on crystallized intelligence, nonetheless. So where does that leave us? This is certainly one of those areas where kind of the more you learn, the more you realize that there's still an awful lot to learn. And sometimes I feel the more I learn, the less I know. It does really speak to the mitigating effect of balance. What I've learned in working with adolescents is that, not just working with adolescents, what I'm increasingly learning on my own life journey is that balance is key. And certainly as it relates to screen media use, I think if you keep that in mind when you are attempting to counsel and provide guidance, then that's probably some good advice. So let's take all of that information, just look at our time here, take all of that information and now try and look at some of the key recommendations that came from the CPS's position statements. So that's the background knowledge. Now, how do you use it when you're working with teens, children, and their families? Yeah, this is this was published 13 years ago, but it just draws upon what I spoke about earlier in terms of my early interest in this area. So we adapted the 4M approach for the position statements, mostly because it's easy to remember, and I think it really hits a lot of the key points that we want folks to try and come away with. 4M approach includes issues such as managing, SMA, meaningful use, modeling, and monitoring. So what do we mean by managed screen use? If you look at a lot of position statements across the globe, one of the things that you will see very, very frequently speaks to the importance of media plans or family media plans. And this is something that certainly I think is really important in terms of communication and just, having an understanding amongst, all members of a family about what expectations are. We want families to be present. We want parents to be engaged as much as makes sense when screens are being used. We encourage caregivers to speak proactively with their teens about, what's acceptable and what's unacceptable. And I will tell you firsthand that you can have these conversations many, many times. And although you think your teen may get it and may understand and may say, yes, Dad, I got it, it doesn't always translate to action on their behalf. It's important to stay in tune with what's happening online. Obtaining passwords for online accounts, I think certainly early on is something that we would, it's something that you can think about. This is not all necessarily absolutes that you absolutely have to do, but I would say that you want to strongly consider. And based upon what we know about multitasking, we want to try and steer away from that as much as we possibly can. In terms of encouraging meaningful screen use, this is certainly important. I would say that participating in these endeavors has helped me as well in terms of reflecting on how I use screens. But prioritizing face-to-face interactions, sleep, critical, and physical activity over screen use. Face-to-face interactions, I think, is something that I can't speak highly enough about. And I see that almost daily, as it relates to people's increasing reliance on interacting with others using technology and not, and, you know, people have gotten away from conversations. You know, they're texting almost exclusively when, you know, I don't know how many people on the other side of this screen have been drawn into this, but, you know, you're attempting to try and get a point across, and you know, hundreds of texts going back and forth when, you know, a quick phone call that would probably last, you know, no more than 3 minutes would actually be far more appropriate. Choosing developmentally appropriate content, try and maintain a presence, you know, even as your adolescent is becoming a young adult, prioritizing screen use that is educational, active, or social, and be a part of your child and youth's media experience as much as it makes sense. Modeling healthy screen use is also important. So we want to encourage parents to reflect on and model their own healthy media use. We want to target daily screen-free times. Turn screens off when not in use. You know, when we come home from work, where are the phones going? Or kids are coming home from school, where are the phones going? Are they staying in our pockets? You know, is there a central place that we can drop them? We certainly, at the very least, want to try and avoid screen use at meals. For adolescents and for adults, we want to try and kind of put our phones away at least an hour before we're going to bed. And of course, we want to avoid dangerous activities like texting while driving, biking, etc. Want to monitor for problematic screen use. So this would include, you know, complaints about being bored or unhappy without access to digital technology, challenging behaviors in response to screen time limits. Something that has become an issue in my house. I have 3 children, the youngest of which is 8, is, you know, my youngest getting up early in the morning before I'm awake to try and seek out a screen, which is, you know, now required us, myself and my wife, to kind of have these screens kind of in our own bedroom when we're going to bed. Challenging behaviors in response to screen time limits. So again, I have my middle guy. I would say that if he spends any more than 45 minutes to an hour kind of watching TV or watching shows on YouTube, he turns into a completely different person. Screen use or time that interferes with face-to-face interaction, physical activity, school, or sleep. And then just monitoring for negative emotions after using social media, texting, or playing video games. And this is certainly something that, again, I can relate to personally, probably more so with my adolescent than the younger children on that one. So those are the recommendations. Now, how does any or all of that make sense as it relates to COVID-19 considerations? Well, I think COVID-19 has impacted us all in different ways. As it relates to mental health, we are seeing, you know, a tsunami of effects that in the world of adolescent health and eating disorders. And I think it's really, really, really important on all of our assessments now that we're trying to better understand, using kind of our history gathering, how core social determinants of health may be or have been affected by COVID-19. It's important to try and understand how individuals and families are coping, the stressors that have arisen, and strategies that have been put in place to try and address pandemic-specific issues. For those of you that provide care to adolescents, you know, what I've learned over the years is that, you know, having a familiarity with the resources that are available is really important and really key. You know, having these things in your back pocket to be able to kind of provide, and, you know, and whether it's, you know, handouts or it's, you know, just, you know, you're verbally providing some of that guidance and support in terms of options to youth and their families. You know, the importance of that can't be understated. The other thing that we want to try and do as best as we possibly can is support access to healthcare visits. In spite of the pandemic, you know, and I think we've stepped up here at the hospital to try and, you know, ensure that kids that need to be seen are being seen, but we need to continue to be vigilant and use. This is a little bit ironic, but we want to use screens and digital media where possible and as possible if the in-person visits can't happen. For parents that had concerns about SMA before the pandemic, this gets tricky because clearly COVID-19 has resulted in, globally an increased reliance on screens, which for some will increase risk, but for others it may bring some degree of reward. Certainly, I was online trying to find tangible evidence that speaks to increased screen media use throughout the pandemic. And there's very little that's been published that speaks specifically to children and adolescents. Almost all of it is in adults, but all of the adult literature is pretty convincing. Not surprisingly, that SMA has increased. Digital game distributors have reported significant increases in game use, in online gaming use in the early months of the pandemic. So it's important to understand how the youth is coping, how the pandemic is impacting their, activities of daily living, how they're functioning, as an individual in terms of their peer connectedness. Clearly, the pandemic increases the risk of social isolation. We want to try and promote connectiveness, making sure that, children and adolescents still have opportunities to stay in touch with their peers. Active engagement in these areas is really key, but clearly parental oversight is also critical. And hopefully one of the things that, I've said that, the themes in this message is consistency. So consistency as it relates to the way in which you support your child or your adolescent, and consistency as it relates to the messages that are being delivered. So to summarize, SMA can and is likely associated with both health benefits and risks. I think it's important, again, and I can't say this enough, to try and keep the issue of balance in mind. A 4M approach to SMA guidance offers a good general approach to anticipatory guidance. I'm not saying that 4M approach is going to kind of check every single box, but if you keep that in mind, I think it'll help keep you on the right path. And we all, as healthcare providers, play an important, and some of us play an absolutely critical role in health promotion across all ages, within and outside the pandemic. And again, I've said it numerous times, and I'll say it one last time, that active engagement and parental oversight in this area is really key. I'm going to stop there, hand it back to Kieran. I think I have to press stop share.
So thanks very much, Mark. That was really an excellent overview of this critically important area. Excuse me. I just have a question in relation to the ABCD study. Yeah. And presumably there's a huge amount of data that's collected over the course of the study. I would imagine that much of it was collected by on-screen use, as in the participants completing, questionnaires and other aspects by smartphones and other stuff. Was the time that was taken for that completion taken into consideration in relation to their overall screen time use? And did it ultimately lead to more SMA activity? And did they factor for that in their data?
Yeah, so good, excellent question. I mean, I think it's at the end of the day, it's going to be a great study that provides a lot of data. Certainly for all of the researchers that are online, that ethically, when you're attempting to plan studies that seek to answer as many questions as this study would have sought to answer, there's always the balance of, how can we collect as much information as we possibly need, but also be mindful of the amount of time that it does take. And those first intake appointments were 6 to 7 hours in duration. My understanding is that, as it relates to the actual psychological measure completion, So they certainly were, those were online, those were gathered using kind of devices, iPads or tablets, and likely took on the order of, 3 to 4 hours, which probably seems like a lot, but in our world, is actually relatively reasonable. Just to put that in context, when a child comes for an eating disorder assessment here at CHEO, they undergo, a battery of different assessment measures at intake, which can easily take a couple of hours. Now, one of the big questions I think that we need to kind of consider is whether, there's some potential bias in terms of who's actually entering this study. And I'm not sure, I'm not sure exactly how they've addressed that, but that would certainly be something that I would be interested in, in looking at further as information becomes more available. Because my sense would be that it would take a special type of person to be willing to sign up for a study that involves that degree of input, and they're being contacted every 3 to 6 months.
Yeah, right.
Over the course of a decade. So it's a lot to ask.
Yeah, agreed. Thank you. There was a question about giving examples of media multitasking for different age groups. Can you give some examples of what that might entail?
Well, so the obvious, again, for those of you that have your own adolescents, would be, I can walk into my daughter's, room at any given time and ask her what she's doing, because it's not clear to me exactly what she's doing, because it would appear that she's trying to do 6 or 7 different things at once. And so that would include listening to music, that would include texting, that would include looking at TikTok, that would include doing her homework, etc. So when we talk about media multitasking, we're talking about the conglomerate of different activities that will and often present itself at any given time that are SMA oriented. So what we try and do is say, let's put the phone away. Let's focus only on your schoolwork right now. The very quick reply that you will often get, or at least that I often get, is, but Susie is helping me with my homework. Mm-hmm. And we have group projects that, I have a group chat that's going on over here. And so we're discussing this. And so this is the problem when you have intelligent adolescents, that their ability to debate and engage is somewhat exhausting.
Okay. Stasia, you had a question.
Oh, yes. So I was just wondering, I think we know that some people youth are more vulnerable to sort of misinformation online or even radicalization and extremism. I was just wondering if you had any thoughts on how to mitigate this beyond just parental kind of control or family efforts.
Fair enough. Yeah, I mean, I think that would be the first point for sure, is the as a healthcare provider, I think our role is really important. And I've seen this time and time again. But it's not just in the healthcare providers. I think you increasingly see this immersed in, in what the schools are doing, the messages that they're trying to kind of promote. Everybody has, a role to play as it relates to providing education in this area. I agree with you fully that there's probably 5% of youth at any given time are going to be at very high risk for adversive experiences, and that number is probably higher. But it's really important that as the adults in their life, regardless of what the context is, that we're all trying to kind of shepherd and keep them on task. So I'm not sure that I can directly answer it, except to say that, any adult influencer, has a role to play.
Sunita, you have a question.
Hi, Mark. Thanks for that talk. I was at a lecture about media use, screen use, and one comment that came up that I find very useful to use on my own kids and onto my patients is the 3C approach. So that's using media appropriately for care, creativity, and calmness. And I've used it for a lot of my pre-adolescent kids, and they seem to understand that concept, that these are the 3 healthy ways of using media. So I just thought I'd share that with you.
No, for sure. And certainly, this speaks to the point that the more you read, you will see a lot of acronyms show up. The challenge again with a lot of adolescents is, they're smart. And so, I could, if I'm the adolescent and you tell me that, I can come back and say, well, that sounds like TikTok. That is for sure what I'm getting from TikTok. I've learned a lot. The tools and the recipes that I get online are just amazing. Yeah, I have a lot of stories that I could share. I'm just not sure they're all necessarily appropriate for grand rounds.
Heather?
Okay, I'll unmute. Well, thank you very much, Mark. It's so relevant to all of us. Anything about SMA burnout, though, because I think for adults, we're talking about too many Zoom calls or just getting fatigued that all of our work is online. Because a lot of children and teens are choosing online learning and then also doing it for social reasons and that. Do you think, or any chatter in the media or in your research about them burning out or having too much? Excellent
question, Heather. So, interestingly, I've not really read much about that. I've not seen a whole lot of studies that have looked at that, but I can speak to it personally, not personally, but kind of professionally.
Yes.
And certainly what I would say is that, and Steve or Amy can speak to this as well, not uncommonly what we see in the adolescents that are struggling is that when they are struggling, regardless of where they're struggling and what the continuum is, it's really difficult to kind of to take a step back and to kind of ask for help or to have the insight to be able to step away. And certainly what I've seen, and I can speak to this personally for sure as well, is that if you think back to that slide on, just trying to be mindful of signs of problematic use, if parents are starting to see that or have concerns about that, then it probably is time to kind of take a time out. And if you take a phone away from an adolescent, on the 6th floor on 6th North, it's interesting. In every other part of the hospital, you're allowed to have your phone when you're admitted to hospital. On 6th North and the eating disorders unit, you're not allowed to have your phone for issues that relate primarily to privacy. And so when we have patients that start off service and eventually get moved up to 6th North, there is no doubt that this is the biggest issue that relates to their transfer. They do not want to go to 6th North, primarily because they know they lose their phones. And what we see not uncommonly is that there is a bit of a washout phase. It takes a couple of days for them to kind of, to take it out of their systems. But maybe for those of you that have attempted to do this, after a couple of days, you start to kind of, feel a little bit more awake, a little bit more alive. That Zoom fatigue, kind of the fatigue in general the haze starts to clear. Fog burns away and you're feeling better in many ways. So if I'm counseling parents, I would counsel them, in that regard to say, if you're concerned, then, maybe you need to take the phone and maybe you need to see, what happens over the course of, you won't see it in a day or two. It'll take probably on the order of 5 to 7 days before you start to kind of, get your child back, if you will. But it's definitely something that I have suggested on more than one occasion.
Okay, time for one last question. I'm going to go to Toby. There are a couple of other comments in the chat. Maybe I'll defer them to Mark to ultimately respond if he has the opportunity. Toby?
Because I have Mark right next door, I can go next door and ask my question, but I see Kalen next might not have the same access. So if you don't mind, Karen, why don't we let Kalen ask his question, and I'll go pick Mark's brain later about our residents.
Sure. Okay, Kalen.
Hi, yeah, thank you for the great presentation. My question was really regarding the anticipatory guidance kind of suggestions you had made, especially with regards to giving out passwords and obtaining passwords from the children. How does that affect the kind of trust and relationship and privacy relationship that the child has with their parent, especially coming into teenage years where that becomes more increasingly important?
Yeah. So I would say, and part of this is, so what may be appropriate for a 12-year-old, you may not do for a 16-year-old. But I think it's very, again, it's kind of one of the, it was, it's like as a pediatrician, I went in and counseled parents and mothers that got admitted around breastfeeding. But until I had my own child, and my wife attempted to breastfeed, like that was really when I learned a lot about breastfeeding. The same can be said about screens and phones and children. It's a very delicate dance in terms of trying to make a decision as to when a child should get a phone, because the phone is not just a phone. The phone is actually not used for the phone. The phone is used for all of everything else that comes with the phone. But at the beginning of that journey, I think it's really, really important to kind of set the framework and to set expectations around responsible use. Now you can have those conversations till the cows come home, and the child may take that and go with it. They may not. But I think the most important thing that I'll just keep coming back to and keeping is keeping the lines of communication open. I don't follow my daughter on any of her accounts, but my wife checks in pretty regularly, and has a look at what's going on, and that seems to work for us. That may not work for you, or that may not work for the next family. I think everybody's going to be, you have to kind of, on some level, you have to do what's going to be most appropriate for your own kind of situation. But I can't stress it enough. Staying engaged is the key. Absolutely the key.
Okay, we'll have to draw it to a close, Mark. Really, thanks very much for an outstanding presentation. I think it was very well received. And I've no doubt there may well be lots of people in contact with you for advice on how to manage things at home. So we'll draw it to a close. Thanks again.